walk you through an informational video on OsSix bone. If you're really excited and interested in bringing extractions into your practice and you want a really easy way to start doing socket preservation, utilizing OsSix bone is an excellent way to start doing extractions in your practice. Using OsSix bone in socket preservation is a very quick procedure. Try an extraction that's very simple, maybe an incisor, an easy premolar. When you are evaluating the shape of the socket and evaluating the shape of OsSix bone that you need, it is definitely advantageous to shape the bone or trim the OsSix bone smaller than the socket. It'll definitely be easier to place. OsSix bone is kind of a brittle material when it's dry. So when you take it out of the box and you're unpacking it and feeling it, it can crumble a little bit, but that's okay. You can trim the OsSix bone chair side to the shape that you would like. It's very easy to trim. You can use surgical scissors. That's what I tend to use. You can use a scalpel. You can handle it with your fingers. You can also use cotton pliers to handle it as well. After I've trimmed it with surgical scissors, I will take my cotton pliers and slide it right into the socket when it's dry. The blood will soak right into the OsSix bone and it will expand and often fill to the shape of the socket. When it comes in contact with blood or with any fluid, it becomes very spongy and you can pack it and push it into the socket as you like it. If you have additional pieces, you can push them into the socket as well. I push the OsSix bone down to the apex of the socket. I don't just put it at the alveolar crest. Once the OsSix bone is placed, a few simple interrupted sutures is really all you're going to need. OsSix bone completely ossifies. When you go back in for re-entry for an implant, the ridge is going to be the buccolingual dimension of it, the vertical height of the bone is going to be there.